At the same time, medical experts in Singapore have warned patients who've recovered from COVID-19 to engage in mild exercise. They say this will prevent blood clots from forming. The condition has been linked to the virus even after a patient has been given a clean bill of health.
The fatal condition was brought closer to home when a 41-year-old migrant worker from China, who was deemed to have recovered from COVID-19, died last week. He was found motionless in his cabin on a cruise ship, where he was temporarily housed after being discharged. The coroner certified the cause of death as a massive blood clot in the lungs following the infection. With emerging data globally, doctors here were told by the Health Ministry last month to look out for cardiovascular symptoms among those infected by the coronavirus.
There is now scientific evidence that the virus can attack the endothelial cells, which are lining the inner lining of blood vessels directly. This causes the blood vessels to be leaky and release a lot of clotting factors that trigger blood clotting. So heart attack and stroke have been reported in these patients that arise from blood clots that blocks the major arteries supplying blood to heart and brain. Blood clots are also found in other parts of the body.
A smaller section of clots that form in the leg may be dislodged and travel through the blood vessels to other parts of the body, sometimes getting lodged in the smaller blood vessels of the lung, preventing blood flow. This leads to shortness of breath. The affected person might experience symptoms like chest pain, heart palpitations, fainting spells, and even coughing out blood. With the constricted blood flow, the lungs will not be able to top up the level of oxygen needed. This in turn causes the heart to go into overdrive, resulting in heart failure. Those who are inactive, the elderly, and also those with underlying medical conditions are at higher risk of this.
There is certain recommendations that doctors are right now considering whether they need to be put on anticoagulant treatment, right, in terms of preventing the potential blood clotting. But this is still an area that is rather contentious because we need to weigh the risk-benefit of administering the use of anticoagulant, which could have side effect of creating unnecessary bleeding in the patient.
But as doctors and scientists continue to learn more about the characteristics of this coronavirus, doctors say light exercises is perhaps the only way to help reduce the risk.
I will rest for the first couple of weeks and thereafter start low, go slow, which means I'll start about 10 to 20% of what I normally do and then ramp up as well as my lungs can tolerate, my body's endurance can tolerate. Again, don't push myself to the maximum because this may be detrimental. Start low, go slow. That's the mantra we should all have.